Hi everyone! For my nutrient presentation, I'm going to be talking about vitamin D. Vitamin D is a fat-soluble vitamin, and it's found in very few foods. Some of these foods include fatty fish, like salmon and tuna, butter, cheese, egg yolks, fortified foods like fortified milks or fortified cereals, as well as beef liver and fish liver oils. It's more commonly synthesized through sunlight and from UV rays. The daily recommendations for vitamin D change throughout the lifespan. For ages 0 to 12 months, the recommended daily value is about 10 micrograms. For those ages 1 to 13 years old, the daily recommendation is about 15 micrograms. For ages 14 to 18, the recommended daily value is also about 15 micrograms, and for those ages 15 to 50, daily recommended value is also 15 micrograms. And for women in this age range who are pregnant or lactating, they should also make sure they consume about 15 micrograms of this vitamin per day. Lastly, those over the age of 70 should consume about 20 micrograms of vitamin D per day. This increase is because older people are already at risk of having weaker and more brittle bones. So they should make sure that they are not deficient in this, because vitamin D deficiency can also cause weaker bones. Almost everyone in the United States has some sort of vitamin D deficiency. This seems quite shocking because not a lot of people know about it. With a lot of work being inside, there's much less people sitting out in the sun to get the recommended amount of this vitamin per day. Vitamin D deficiencies in children can cause a condition known as rickets. Rickets affects the bones, mainly in the lower extremities and the weight-bearing bones. Although it can affect other bones in the body, these are the most common places to see it develop. Rickets can cause weak and soft bones, and in very rare cases can cause skeletal deformities, like in the picture here on the slide. In adults, it can take the form of osteoporosis and osteomalacia. Osteoporosis is when the bone density is vastly reduced. The name itself quite literally means porous bone, so there are a lot of holes in the bones like you see on the picture. It can greatly increase the risk of fractures even with the slightest fall. Osteomalacia is the softening of the bone. This is typically seen in the lower weight-bearing bones, like in rickets and osteoporosis. Symptoms of this one can be bone pain and muscle weakness and can lead to fracturing. A toxicity in vitamin D is also known as hypervitaminosis D. This type of toxicity causes hypercalcemia. This is when there's too much calcium in the bloodstream. Symptoms of this disorder include gastrointestinal problems, such as diarrhea, vomiting, and constipation, as well as bone pain, drowsiness, headaches, irregular heartbeats, muscle and joint pain, weakness, and can even cause kidney stones. Hypervitaminosis D does not usually happen with just food and sunlight. Most of the time, it's caused by the excessive use of supplements. Supplements should not be taken unless recommended to by a physician or a dietitian, as it can usually cause more harm than good. As a sample menu, for breakfast, having about 6 to 9 teaspoons of fortified yogurt, and if you do not like yogurt, you can also have fortified cereal with fortified milk. It will also provide you with plenty of vitamin D. For lunch, you can have an omelet with fresh vegetables. The egg yolk is what provides us with the vitamin D, so make sure to have an egg yolk as well instead of just the egg whites, which is a common way of making omelets. For dinner, you can have about 3 ounces of salmon with sautéed mushrooms. Salmon and other fatty fish are a great source of vitamin D, and mushrooms are also an excellent source of vitamin D. So, all in all, this is a great menu for those who are looking to add more vitamin D into their diet. Through research, I found that vitamin D also helps with cancer prevention. A deficiency can cause a higher risk of developing colon cancer, breast cancer, ovarian cancer, as well as prostate cancer. Studies have shown that taking vitamin D supplements or those with a diet high in vitamin D had a significantly less risk of developing cancer. This was especially seen in those with a high risk of prostate and breast cancers. And that concludes this presentation. Thanks for watching.